Hey everyone, welcome back to the show. I'm your host, Dr. Joseph Koppas, and today I'm joined by my guest, Dr. Jacob Plasker.
Hello, thank you for having me.
Yeah, I appreciate you coming on today. It's a little early for you while we're recording, I think, but appreciate it nonetheless.
Of course. It's getting darker and colder here, so any excuse to get up and get my coffee in me earlier it probably serves me well.
Right. And you're out in Bend, Oregon, is that correct?
That's correct, yeah.
Yep. Very nice. So, Dr. Plasker, you wanted to come on today to talk about concussion and especially support systems surrounding that condition. I'm very excited to get into this topic with you. I think a lot of people can empathize with what you're going to talk about. But before we do that, would you mind talking about, I guess, how you got into the world of neurology? I guess that's kind of tied in with the topic itself, but I usually like to ask that first.
Yeah, great. So I usually tell people there's a short answer and a long answer to that question, but the median answer is when I was 10 months old, I rolled backwards off of my parents' bed and had an anoxic brain injury. And the doctors told my parents that I would never walk or talk ever again. And my father, who was and still is a chiropractor, adjusted my neck in the hospital room. And the way they describe it is I instantly became responsive. I wasn't moving a lot. And after the adjustment, I just began to move around, began to cry, began to just show signs of life that I wasn't previously. And so I grew up really paying attention to how people responded to different kinds of injuries, because I thought it was peculiar that I had such a miraculous, medical defying response to my brain injury, but then again, so many other people don't. And even when they receive care similar to mine, I think there's one thing that I want to talk about today is the lessons I've gleaned from being a patient recovering from a brain injury to a doctor who specializes in brain injuries. And so I grew up with that awareness always. I would see people in the mall that had clearly a very similar injury to me, but they were a lot less functional. And I started to develop this, idea of what I thought it took to recover from an injury. And so fast forward, years and years and years, I went to school for finance because I didn't necessarily love the idea of becoming a chiropractor because of all the stigma that comes with it and things like that. And but I was in school and I was looking for jobs, and I realized that I didn't want to do that. And that was right around when I learned about Dr. Carrick and all the work he was doing, and was fortunate enough to be able to go down to Life University, our alma mater, and be treated directly by him, which was an amazing experience. And during the course of that treatment, he asked me that question, which he asks everybody, which I think is a very poignant question, is if I could do anything for you, if you could pick one thing for me to do for you, what would it be? And as a result of my injury, I have a right-sided hemiparesis, not full function on my whole right side. I walk with a little bit of a limp. I don't have full function on my arm and hand. And so I looked at him and I was like, I would really like to be able to have better function on my hand. At that point, I was 21, 22. And I'll never forget what he told me. He looked at me and he told me that given what happened to you, your motor function is remarkable, but your cognitive function, I know, is not where it should be. And that completely destabilized everything I thought I knew about myself, everything I thought I knew about the brain, because from my perspective, I had always considered myself a pretty smart guy, and but there were all these things that I couldn't do with my arm and my leg, and it taught me that your perception of what your situation is not always reflective of the reality of what the situation is. And so after that experience, I went through his 5-day intensive program, and instantly felt my mind become clearer, felt my vision become sharper. I was just finding myself in a whole bunch of different contexts, just being able to respond and function at a higher level. And it was just a huge wake-up call for me, and it was the push I needed to enroll in chiropractic school and then immediately start the functional neurology program.
Okay. Yeah. With that, sorry, I'm just gonna. So I just want to backtrack a little bit. Obviously, you and I went to chiropractic school, and we learned a lot about the benefit of the adjustment and that sort of thing. Most people listening probably aren't aware of why you were adjusted when you were a baby and why that helped in that moment. Can you touch on a little bit why that was helpful for you?
Yeah, sure. Because I was 10 months old and I don't really remember a whole lot. Obviously, we don't really know the mechanism, right? Because my father is a classically trained chiropractor, and if you asked him, he would say that I had a misalignment in my neck that was putting pressure on certain structures and not allowing my brain to work correctly because of the intimate connection that the spine has with the nervous system. And I think that there's definitely probably some truth to that. But what we also know is that when you adjust a joint, especially a spinal joint, especially an upper neck joint, there are a whole host of consequences that are stimulatory, which means that they very powerfully activate the brain and serve as I kind of think of it as like just turning a battery over, where you're just providing an impetus for a whole host of neurological consequences. And so obviously in practice, we see things like that all the time. And regardless of the paradigm that you come from, there's been no question that that line of thinking, that, more compressive impingement style of thinking has helped a lot of people. And one thing that I've been fascinated learning about the brain and learning functional neurology is the consequences of something you might do are there independent of your awareness of them, right? So that's what I would say about that, is how, and I'm very grateful that he was trained the way he was, because he's a very skilled practitioner and he really knows what he's doing. And it's so funny because at the same time, the paradigm that he's trained in is not necessarily the paradigm that I come from. And so I think that's informative, because it, again, illustrates that idea that the things that you do for your brain have consequences, whether or not you are aware of their consequences or can understand their consequences.
Speaking of, I guess, consequences, and there was obviously a change in your life trajectory as a consequence of being treated by Dr. Carrick in Atlanta. What were some of the perspectives and takeaways from that whole experience? Because obviously it changed, like I said, the trajectory of your career and your life after that.
Yeah, so I have a couple of things. One is it it showed me the power of communication paired with understanding. And so I took away from Dr. Carrick a couple things. One is his ability to see the things that nobody else can see, and to treat the most minute details of the way I walked, the way I moved, the way he felt my neck to be moving, the way he saw my eyes move. All of these things which seemed really subtle to me, all of a sudden he was like, did you see that little movement of your eye? And I was like, yeah, I did. But like, what does that mean? And it showed me that if you have the right training, and if you can really understand how the brain interacts with the body on a deeper level, then all of a sudden a whole different level of majesty with regards to human physiology is opened up to you. So that was one thing I was really impressed by, his ability to make to place significance on things that I found, to be honest, pretty dull. A little eye movement, what possibly could that mean for me? And we know now that every little thing that we can pick up could just be the one thing that helps a person regain function that they haven't had before. Another thing I picked up from Dr. Carrick is, if we're going to accept this idea that the brain controls everything, and that we can treat those little things as significant, then we can also expect a lot more from our therapies with regards to a time frame. And I think that's one of the things that really separates functional neurology from some other neurorehab paradigms, is if I do a therapy and it doesn't change something, either for positive or negative, immediately I know that's either something that I'm going to continue using, or it's something that I know I'm going to abandon. I don't wait. You don't have to wait until you've done 6 months of treatment to make a decision about whether or not something is going to be good for somebody. And so I was really just taken aback by just how confident he was in himself, and bordering on arrogance maybe. But as I went through the program, his treatment program, I just learned that it's not arrogance, it's confidence in the brain's ability to rewire itself, to change its functionality based upon the input that it's given. And that was a revolutionary idea for me, because I had been to a whole bunch of different doctors, and chiropractic was always the thing that just I knew worked the best for me, and everything else was just kind of ancillary. And so those are my two big takeaways, is the fact that if you know how the brain works on a deeper level, you can place much more significance upon what seems like trivial findings, and also just expecting change based upon what we know about how stimulation changes the brain.
I think you put that perfectly. Yeah. Now that you're in practice yourself, and basically in Dr. Carrick's shoes and treating patients, having had the experience that you had going through the process, the vulnerable process of having somebody take a deep dive into what your brain looks like, how it's functioning, how has that changed the way that you practice and approach patients who are now in your shoes?
Well, I would say that, one, it has given me something to shoot for, because I know what's possible if you are able to hunker down and do the work to really understand things on a higher level. So one is just an expectation from myself, to really to not take things lightly, to not, you know, do a half-hearted exam, and to not just settle for a result that I think cannot be replaced by a better one.
Mhm.
And also, if we go back to kind of how we started this conversation, or how Carrick starts his conversations by asking people, you know, what's one thing I can do for you? I think that really separates the functional neurology approach as well, because I think a lot of people try and make their patient fit into their paradigm, as opposed to letting the patient dictate the goals of their care, right? So if the goal of their care is to be able to play basketball again, and you know, you do something to them and you get really excited about the result that you get, but it doesn't allow the patient to achieve their goal, you know, what have you really done for the person? You know, you can
Mhm.
make the argument that just because they're not aware of the thing that you did for them doesn't make that a bad thing. But ultimately, if we can leverage what we know about the brain to give people the things that they find important back, as opposed to just treating what we consider to be significant, I think that that's a more patient-centered model. And that's something to shoot for.
Mhm.
Um, and then I would also say that, I guess now I lost my train of thought.
That's okay. So, in your experience as a patient, it sounds like you had a very good support system in, your father. He was able to provide adjustments and then take you to a bunch of other doctors. It sounds like he was on your team, trying to help you get better. It sounds like he linked you up with Dr. Carrick eventually. How important is that as a patient to have that support system, and how do you think that helps dictate their success recovering?
Yeah. So your response to what happens to you is everything, because there's so much in our life that we're not in control of. All you can really control is how you respond. And so I think that was, I mean, if in addition to the adjustment, um, the the way my parents responded to my accident helped to shape how I view the world. Because you know, the way that I look at it is they had two options. One is they could have, you know, if a doctor tells you that you're never going to walk or never talk again, you can go home and you can research the best way to make a child who can't walk comfortable. You can go home and you can install lifts up the stairs, and you can install assistive devices, and you know, really kind of modify the environment so that you move through the world with your deficit, but as comfortable as you can be with that deficit. But instead of going home and researching what are the best wheelchairs, what are the best assistive devices, they went home and they researched what is happening in the world of neuro recovery, what is happening in the world of neuro rehab, what is happening in the world of neuroplasticity. And that's a completely different path,
Yeah.
right? Because one accepts the state of where you are, and one doesn't. And through that process, you know, I saw some brilliant therapists and brilliant doctors. I did a lot with the National Association of Childhood Development, which is kind of the precursor to me of functional neurology. You know, it's the idea that the brain changes with regards to what stimulation and what demands you place on it. And um, so I was always doing a different therapy. We were doing It's called digit spans at the time. We were doing vocabulary building exercises. We were doing movement-based exercises. We were doing sensory-based exercises. They were, putting eye patches on me, and they were making me listen to different kinds of music. And they just did all of these things because they had an instinctive understanding that, and that's been central to chiropractic ever since the beginning, is that, the nervous system is the boss, and it is a contextually and sensory dependent organ. And so if you can kind of marry those two concepts, the whole world opens up.
Mm-hmm.
And so now, fast forward into practice, one main job that I place upon myself is making sure that people have that reaction.
Mm-hmm.
Is that if they've been told by one doctor or two doctors or 10 doctors that this is the way you are, is that reflective of reality, given everything we know about the state of neuroscience and everything we know about your condition? And sometimes that's true when people are told that, hey, you had a stroke at 60 years old, and the chances of us recovering some function for you are not impossible, but you're probably not going to play basketball like you did once before, right?
Mm-hmm.
But other times that's completely the wrong thing to tell somebody, because especially if they are a semi-healthy person, or even a person who has some health challenges and then has a head injury and has all these deficits. We know with a concussion there's very little, if any, cell death. And so if all of the structures are still intact, then it's more of a software issue. Let's see what we can do to give your software an update. Mm-hmm. Right? And we know that the hardware changes according to what the software says. Mm-hmm. So that's really important to me, because when people come in and they tell me that they know their situation, sometimes the certainty that you place upon your circumstances is the thing limiting your recovery. Mm-hmm. And so I always hold those two ideas in tension. What is possible based upon what we know, and what is realistic based upon the current and previous state of your brain, given the nature of your injury.
Mm-hmm. I think you brought up a really good, paradigm, the two paradigms. Does a patient want to, and I guess this goes back to their goals ultimately, but does the patient want to adapt to the environment, or do they want the environment to adapt to them now? And you said you have the tension of those kind of two things always in your mind. As practitioners and rehab specialists, obviously we want to adapt the patient to the environment as best we can. How do you balance those two things, and when do you make the decision, or how do you make the decision that, okay, maybe now we need to switch our paradigm and adapt to the environment to the patient now?
Yeah, well, the first thing is, what's the nature of your injury? Mm-hmm. Right? Because it's, you might see a person who has a stroke and a person who has a concussion present with very similar findings. Mm-hmm. But obviously a stroke, especially if you're not really getting into a good rehab program within the first couple of years, which is something that we see all the time, that's going to dictate what I think our prognosis is. I would say that, and a lot of this I learned from, I'm in the middle of Dr. Traster's vestibular rehabilitation board review right now. And I really love his, and this is something that I love about Dr. Carrick, is expect change. And if you don't see change, no matter how minute the level is, almost immediately you have to switch things up or you have to try something new. And so, so what I look for when I do my exam is, what are the findings I think are most significant to your goals, and are they able to be changed? I don't care if it's bad or good in a fraction of, in a, after a couple minutes of therapy. I place a lot of importance on that. And if I spend, an hour and a half, 2 hours with somebody, and they're exactly like they were when they walked in, I start to drift from, a plasticity rehab model to, maybe a substitution or a compensation model. And so that's how I try to navigate that. But I've got that wrong many times, where I go into adaptation a little too quickly, and it ends up being a barrier for people. Or they go somewhere else, they see one of our colleagues that maybe has some more, in-depth diagnostics. You could pick up that one little thing that I just couldn't. So that's how I attempt to navigate that. Is just have that confidence / arrogance that Carrick had that first day to really think that I could make a change pretty quickly.
Yeah. I think that was a good way to wrap up everything we've talked about today. We are just about out of time, Dr. Plasker, but I wanted to make sure that I gave you a few minutes to go over anything we may have missed that you wanted to discuss.
Yeah. Wow, that flew. There's so much more that I could say, but I'll say this. So part of the way that I view my job, and part of the way that I think caregivers need to view their job, is as a supplementation to a person's individual brain deficit. And what I mean by that is, I think this is incredibly salient to especially, teenagers or adolescent kids who sustain one of these types of complex nervous system injuries, is parts of their brain will go offline, or they won't function the way they're supposed to. And part of the responsibility as a practitioner or a support system is to serve as the supplement to that person's dysfunction. And that's going to really dictate the success of whether or not they can navigate the intricacies of a neuro rehab program. If your frontal lobe goes offline because of a concussion, and you cease having the ability to execute effective planning strategies or to effectively regulate your emotions, part of your job as a practitioner is to serve as that person's frontal lobe, right? If a person damages their parietal lobe and has trouble navigating the kitchen, or remembering where they put things related to, that they might need for their therapy program, part of your job as a support system is to make sure that those functions are supplemented until you can get the function back. And so, that's why we see people who have effective support systems. I think it's one of the number one predictors of their success to them, because if I implement a therapy program, but they don't have the executive ability to execute it, they need help, and that's why having, seeking out those support systems is vital, whether it be a support group, or whether it be, a Facebook message board, or whether it be a family member who has to, go live with them for a little bit. It's going to make all the difference. And understanding the exact nature of what that dysfunction is going to be is going to help inform your role as a caregiver. And so that's what I would say to anybody watching this. If you don't have a support system, or your provider is not an integral part of your support system, then you need to make changes to make sure that you're supported in a way that's going to allow you the maximum chance of recovering as much function as you want in order to re-enter your life the way that you desire.
Yeah. I'm glad you brought that up, actually, because we talked about how the provider needs to determine which paradigm to meet the patient's goals, adapting patient to environment, environment to patient. The support system as well does. You mentioned, if patient has a parietal lobe issue and has a difficult time getting through the kitchen, you as a support system, do you challenge the person you're supporting? Do you keep pushing them to improve, or do you have to say they just can't do it and I need to help them and I need to be there for that? So it's a very I think a delicate decision for both people, even the support system as well, and how far do you push and how much do you help, which I think us as providers can help along with that as well.
Yeah, absolutely. And then I'll just say this one last thing.
Mm-hmm.
I really love the idea of what you just said, and how you frame how that role is taken on. And I think one thing that everybody with some sort of neurological injury, one gift that really gives you is you should now always understand that your brain changes according to the information that you give it. And that's whether or not you have a healthy brain, or whether or not you have an injured brain, right? And I think a lot of people take that for granted, that their brain is a summation of the information and the stimulation that they give themselves. And to be able to take an active role in changing your brain and making it the way you want it to be, I think it's a powerful idea.
Mm-hmm.
And so anybody watching who hasn't really thought about that I now have the opportunity to remake my brain in a way that supports my future goals. I just like how exciting.
Mm-hmm. Mm-hmm. Absolutely. And you mentioned earlier, I guess we as chiropractic neurologists accept that the brain controls everything, and we accept that the brain has the ability to change. So, like you said, make it the brain that you want it to, even after an injury.
Yeah, absolutely.
So if patients wanted to reach out to you or learn more about you and your clinic, things you're working on, how would they go about doing that?
Sure. So they can go on to our website, which is plaskerchiro.com. So my last name, Plasker, Plasker, chiro like chiropractor.com. We try and keep articles popping up all the time that have to relate to things not only related to neuro rehab, but also to just health in general. And then also my email is drjacob@plaskerchiro.com, drjacob@plaskerchiro.com. And if anybody wants to send me an email, wants more information about the things we discussed, I'm happy to give out my email, and will always try and get back to people in a timely manner. But they can reach out to me in either of those ways.
Mm-hmm. Excellent. And we'll try to add those into the show notes too as well, so you'll be able to find
Perfect.
them down there. Thank you again for coming on today, Dr. Plasker. I think this was fantastically informative episode. I think whether a patient's listening to this or somebody who knows someone with a brain injury, they should be able to get a lot of takeaways from this episode.
Yeah, thanks, Joe. It was a pleasure to be on. I look forward to maybe doing it again one day.
Absolutely. I'd love it.
Yeah.
All right. Well, I'll let you get on with your day. Thanks again. And this has been your host from the Neuro Wellness Podcast. Be well.